Well, Health and Human Services Secretary Robert F. Kennedy Jr. testifying before the Senate Finance Committee today. This all comes after recent shakeups at the CDC, including the firing of Director Susan Monterez, as of resignations of several senior CDC officials. Senator Marka Cantwell grilled Kennedy about the cancellation of $500 million in research on mRNA technology.
You canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines.
Dr. Josh Michaud, the Associate Director with KFF's Global Health Policy program, joins us live. Doctor, thank you so much for being with us. So how will that funding cancellation impact the development of future medical treatments using the mRNA vaccine technology?
Yeah, as we know, the mRNA vaccine technology was kind of miraculous and provided us with the COVID vaccines that both Republicans and Democrats have, rightly lauded as saving many, many lives during the pandemic. And what this vaccine research was going to do was to, provide a down payment on future research, development of future vaccines that would treat potential future outbreaks and pandemics of respiratory diseases. So you can imagine that without this funding, it will take that much longer. It will, the vaccines that may be developed, it may not be as effective as they would have had we had this science under our belt. The mRNA vaccine platform has had decades of past research to support it, and it was poised when the COVID pandemic happened. And so we don't know when, of course, the next pandemic will occur, but we may be tying one hand behind our back if we don't fund this research going forward.
Yeah, I'm curious because there's been some clinical trials that are going on right now using mRNA technology for cancer vaccines, cancer treatments. What will happen to those studies?
As far as I know, the canceled contracts refer only to the respiratory disease research. So this pandemic preparedness, for future flu pandemics or other respiratory diseases. The cancer vaccine research is still supported through the federal government, although to what extent it's not quite clear. So these are all promising areas of research, and to shut one down in favor of another doesn't seem to make a whole lot of sense based upon what we know about their effectiveness and safety.
What do you think we can expect in terms of coverage for things like vaccines for people who are on government health care, like Medicaid or Medicare? Are they going to have to pay for those vaccines in the not too distant future now?
Well, one thing we've seen come out of the FDA is a restriction on who they approve the coming COVID vaccines for. So under the new FDA policy, only those over 65 or those under 65 who have a high-risk condition will have the vaccine will be licensed for those individuals, but not others. And so that leaves people who are under 65 and don't have one of these conditions in a difficult spot in many situations. So we don't have a recommendation from the CDC advisory committee yet. They're supposed to be meeting in a few weeks to discuss COVID vaccines and whether or not to recommend them and to follow what follow up on the FDA approval. So we're kind of in a limbo period. What we could see is that the FDA, the CDC will come out and say much the same thing as FDA has. And that would leave people without an option in some cases where if they don't have a high-risk condition, they may not be able to access the vaccines because they won't be able to get a prescription from their doctor. And insurers may not cover it.
What do you say to folks who are concerned that the information coming out of the CDC now does not align with what other doctors are advising? Where should people go to for information if they don't trust what the CDC is saying?
Yeah, it's a very difficult position for anyone, parents as well, to just, to look at what the CDC is saying versus what other organizations are saying. Right now, the disagreement comes in the forms of recommendations for the COVID vaccines, where you have medical groups saying, everyone should get the COVID vaccine, but as we said, FDA saying it should be limited to those 65 and older, those with high-risk conditions. So who do you trust? In our own KFF polling, people tend to trust their private providers, their state and local health departments more than they trust the federal government. But it does leave parents in a tough situation if they have to make a decision for their kids or for themselves about whether to get the COVID vaccine. And we don't know whether this same kind of situation where we have conflicting recommendations coming from different groups apply to other vaccines in the future.
Dr. Josh Michaud, thank you so much.